My name is Judith. Zumi is my videographer and Brianna is my evaluator. Okay, so we have Jamie Wheeler, who was admitted from a skilled nursing facility yesterday. He has a past medical history of dementia, and he is more confused than usual, noted from the skilled nursing facility. He's also become less mobile due to his rheumatoid arthritis. His provider has written some new medications for him this morning. So first I want to check my provider's orders. So I have, for Jamie Wheeler, I have erythromycin, 200 milligrams by mouth 4 times a day. I have the varicella vaccine. I have 0.5 milliliters subcutaneous now. And I have the dexamethasone, 4 milligrams IM and now as well. I also noted that he is allergic to codeine, and then he has no other labs that would contraindicate anything. So I'm gonna check my MAR, and once again, he is allergic to codeine, and I also am going to pull erythromycin for 250 milligrams by mouth 4 times a day, but right now, since it's just this morning, I'm just gonna pull his first dose. I'm also gonna pull for his varicella vaccine, which is 0.5 milliliters subcutaneous, and I'm also gonna pull his dexamethasone, which is 4 milligrams IM. Okay. So I have my erythromycin. It is not expired. And it is 250 milligrams. And with my MAR, he is getting erythromycin 250 milligrams. It is once again for Jamie Wheeler, and it is going to be by mouth, and it's 4 times a day. But since it is the morning, we're just going to give him his first dose. I'm also going to go ahead and pull his dexamethasone. His dexamethasone is not expired. It expires in 2030. It is 4 milligrams per milliliter, and the dose that he's looking for is 4 milligrams. And then I'm also going to go ahead and pull his varicella vaccine. So his varicella vaccine is for Jamie Wheeler is not expired, and 1 dose per 0.5 milliliters. His varicella vaccine is 0.5 milliliters subcutaneously that I'm going to give. So for his IM injection, which is going to be the dexamethasone, he only needs 1 milliliter, so I'm going to go ahead and pull the blunt tip and syringe as well for that, as well as pull some alcohol swabs. I'm also going to grab my syringe from my varicella vaccine as well. I'm going to go ahead and I'm going to pull my 23 gauge needle, and this is for my IM vaccine, which is the dexamethasone. And then I'm also going to go ahead and pull my 25 gauge needle, which is for my subcutaneous vaccine, which is my varicella. So the subcutaneous vaccine would be up in the back of the upper arm, but since there is no pad, I'm gonna administer it in the abdomen. And my dexamethasone, since it is less than it's 1 milliliter, I'm gonna administer it in the deltoid. So then before I go into the patient's room, I would do my second check with my medications. So once again, for Jamie Wheeler, I do have my erythromycin, which is this. He is prescribed 250 milligrams by mouth 4 times a day. It is just his morning, so I'm going to give him just his 250 milligrams dose, which is 1 pill, and once it is not expired. He's also getting varicella vaccine of 0.5 milliliters subcutaneously. So his varicella vaccine is not expired, and 1 dose is 0.5 milliliters. Jamie Wheeler is also going to get dexamethasone 4 milligrams IM, and his dexamethasone is not expired and 4 milligrams per milliliter. And then I have all of my needles in. So then I would go in the room. Hi, Mr. Wheeler. My name is Judith, and I'm going to be a nurse today. Could you provide first name, please? and your date of birth. And I did note that you are allergic to codeine. So I'm gonna put hand hygiene, put on gloves, and provide privacy as well. So today I'm going to be giving you your erythromycin this morning. That's going to be 250 milligrams, and you get that 4 times a day orally. I'm also going to be giving you your varicella vaccine, 0.5 milliliters, and you'll be giving you that subcutaneously. So normally I would put it in the back of your arm, but today I'm going to put it in your abdomen. I'm also going to be giving you the dexamethasone, which is an IM injection, and that I'll be putting in your deltoid. So for my third check, so I'm going to do my erythromycin. It is not expired. It's for Jamie Wheeler, and it's 250 milligrams. His MAR is for erythromycin, 250 milligrams. By mouth, it is orally. And it's 4 times a day, but since it is just the morning, he is only going to be getting 1 pill.
And for heparin, prolonged, there should be prolonged
and because it is a capsule, I'm just going to empty the contents.
37, so it is good to use.
Discard, and then I would mix it with some applesauce for Mr. Wheeler. Are you having any difficulty swallowing before I give you your erythromycin and your applesauce? No? There you go. And then here's some water just in case to wash it down. 3. You just open your mouth for me, and I see if you took your medication. Thank you.
Expiration date is 2030, so this is good to use. Jamie Wheeler, vaccine, 5 milliliters subcutaneous.
Alright, Mr. Wheeler, now I'm going to be giving you your varicella vaccine. The varicella vaccine, so I'm going to do my third check for this. It is it's not expired. It is 1 dose per 0.5 milliliters, and Mr. Wheeler is getting 0.5 milliliters subcutaneously. And once again, I would be putting it in the back of the upper arm, but since it doesn't have an arm pad, I'm going to be using it. I'm just going to do a quick skin check on your abdomen before I go ahead and administer it. Alright, let's feel right. So. It was capped, but I'm just going to go ahead and thin it with an alcohol swab. I'm going to try it by hand first.
This one is 2030. This one's good to use. For Miss Jamie Wheeler, dexamethasone, 4 milligrams, which is 1 milliliter. Intramuscularly.
I'm just going to go ahead and make sure that I am using a 25 gauge for my subcutaneous.
3 milliliters.
I'm just going to pull back to 0.5 milliliters.
This is clear mouth. I'll just get that one ready in the room for her. Start with the dexamethasone.
I am now. Folate 200 milligrams EO daily. And then heparin, subcutaneous every 12 hours.
Again, that's 4 milligrams, which is 1 milliliter. So we grab the 3 milliliter syringe.
Okay. I'm just going to go ahead, so I'm going to do it 2 inches from the umbilicus. I'm just going to go ahead and clean this from Mr. Wheeler.
How long is that?
I'm gonna go in at a 90-degree angle. Administer slowly. Okay, and then I would hold for 10 seconds. Now, Mr. Wheeler, for your varicella vaccine, so we were just giving it to prevent varicella infection. Some common side effects would just be soreness in the abdomen, a fever, redness, or rash with a shot was given. But I will be back in to check on you in 30 minutes, and after I'm done this, and also if you do need me and experience any adverse effects, you can press the call button. Also, with your erythromycin, it is an anti-infective, so it's an antibiotic, and it's for an infection, and just common side effects would be nausea and vomiting, and that as well. If you do experience any adverse effects, please use the call button, and I will be back in about a half hour. So lastly, I'm going to do the dexamethasone. So it is for Mr. Wheeler, and he is receiving 4 milligrams via IM injection. It is 4 milligrams per 1 ml, and it is not expired. And this is going to be an IM injection that is going to be in his deltoid because it is a 1 milliliter. Air drying. So Mr. Wheeler, dexamethasone, it is an anti-inflammatory, so it is a steroid. So some common side effects would be depression, euphoria, hypertension, anorexia, nausea. But we are going to be monitoring you closely as well.
I will be getting a varicella vaccine. Jamie Bueller needs 3.5 milliliters. One milliliter.
Alright, Mr. Wheeler, dexamethasone is going to go in your deltoid. It's going to be 2 fingers from the acromion pouch. So I'm just going to go ahead and clean that off for you. And skin integrity is intact for the deltoid as well. I'm going to use the Z-track method and go at the angle.
Since this is subcutaneous.
And I would hold for 10 seconds.
That is 5 stitches.
Start. Alright, Mr. Wheeler, I'm just going to double check to make sure you're not having any reactions. Your abdomen is good, as well as your deltoid. If you do need anything from me, you can either call it, but I will be back in 30 minutes to check on you just to make sure you're not having any adverse effects. And are you comfortable? Okay, that's great. So then I would go ahead and I would document my med administration. So I would do the time, the dosage, the route. And the drugs. So I would document the erythromycin, the 250 milligrams that I did during his first, because he gets it 4 times a day. I would also document his varicella vaccine, which he got 0.5 milliliters of subcutaneously in the abdomen, and I would also document the dexamethasone, which he got 4 milligrams. He got 4 milligrams in the deltoid as well.